This chapter and discussion is going to look at drugs for cardiovascular conditions. Primarily, we're going to be looking at cardiovascular arrhythmias and issues involving hypertension. Again, make sure you're taking notes throughout this presentation. I will be posing the questions that will be posted for discussion board purposes, so please make sure you're noting them as you go through the presentations. So, utilize that and make sure that you're noting which things need to be answered on the discussion board posts. So to begin, we're going to look at drugs that are utilized to treat arrhythmias. So what an arrhythmia essentially is it's some type of physiological or pathological disturbance in the cardiac impulses. So the sinoatrial node and the atrioventricular node are going to control the rhythm of the heart. A person with an arrhythmia, and there's different types of arrhythmias, they're basically unable to maintain a normal heart rhythm. So the issue with this potentially is that they could end up suffering from a cardiac arrest if it's left untreated. There are certainly more benign examples of this. There's various types of arrhythmias. The question becomes, what type of arrhythmia does the individual have? And obviously, when you look at the patient population we commonly work with, this could become a major issue. So it's really important that that as an athletic trainer covering particularly a sports team, if you have any individuals that you're making sure if they do have an arrhythmia that the medication they're keeping up with them appropriately. Your more benign examples, which your textbook talks about, the premature atrial contraction and premature ventricular contraction. So this is the first question on the discussion post I want addressed. What can cause symptoms with the PAC and the PVC? Why are they benign? How are they diagnosed? That is the first thing I want addressed in the discussion post. So we're going to talk about the different classes of medications associated with being able to treat arrhythmias. One thing to look at that could come up, and this is another question that I want addressed, what is the red flag that could come up during the physical that would kind of make you think that possibly a cardiovascular problem such as this could be an issue? So the next two slides, and this is just kind of outlining some of the more common types of arrhythmias. There's also these are also listed in your textbook. Table 6.2 on page 83 will have some of these listed as well. So you have to think about, again, when you hear, we know that tachycardia is an abnormally fast heartbeat, bradycardia is a slow heartbeat. So a lot of the names, you could kind of tell what is happening with the particular type of arrhythmia, whether it's the heart is speeding up too much or slowing down too much. So take a look at these and just be aware, be able to recognize based on the names what some of the issues are as far as the arrhythmias are concerned. And these are just a few more of the arrhythmias. Now, in certain instances, you notice that it'll say variable, so that means your characteristic rhythm, it may not necessarily just be fast or just be slow. It means variable, meaning it could be either one of the two. So in some instances, you do have situations where it could vary between speeding up too much and slowing down too much. And just some other type of arrhythmias as well. Again, notice whether it's a variable characteristic rhythm, whether it's too fast, too slow. And in some instances you see here, for instance with the ventricular fibrillation, you have just a totally uncoordinated rhythm, which the fibrillation, if you've probably heard that term by now, it's not that the heart is not beating at all. It's just a non-functional kind of rhythm where the particular portion of the heart is just sort of quivering as opposed to going through its normal beating pattern. Okay, so going through the different types of drugs used to treat arrhythmias. So again, as I had listed previously, and they're also broken down this way in your textbook, you have class 1, class 2, class 3, and class 4, and then there's specific mechanisms associated. So part of what I'm looking, again, for you to kind of see on top of the adverse effects and some of the interaction issues and just being able to recognize names, I want you to understand the mechanisms by which these work. So, with these, there's not so much concern with knowing dosages and things like that because it's sort of impractical for you to know those. But you should be able to recognize, again, names, be able to recognize the mechanisms by which they work. So for instance, here we're starting out your sodium channel blockers. These are used to decrease the excitability of the cellular membranes. So with the sodium channel blockers do just that. They block the sodium channels within the cells. Your adverse effects, hypotension, so the possibility to significantly reduce blood pressure, and the potential to actually worsen the arrhythmia. So it's, it would be odd to think. So again, when physicians are prescribing these medications, they really have to look at what type of arrhythmia the person has, and also look at what type of activity level they're going to be involved with, because that's going to be important, obviously in managing the potential adverse effects. Your class 2 drugs used to treat arrhythmias are known as beta blockers. So what beta blockers do, they stabilize the sodium-potassium exchange. So, when you looked at the sodium channel blockers, they basically block or inhibit sodium channel activity. What these look to do more or less is modify the exchange of sodium and potassium. These are typically not a good selection for athletes, and there's two reasons for that. One is that they can impair performance. So another question for the discussion post is, how can beta blockers impair performance in athletes? And actually in certain sports they're banned, which sounds kind of weird that they impair performance but yet they're banned. In some sports they can actually be a performance enhancer. It just depends on the type of sport. So take note as to how it would impair performance, and that could kind of take you into looking at, obviously the types of sports where there'd be more of a detriment than a benefit. Your class 3 antiarrhythmia drugs are going to be your potassium channel inhibitors. So what they basically do is they're going to help block the repolarization that goes on at the heart. So they're going to block the potassium transport to the cardiac muscle, and they'll disrupt any type of spontaneous electrical discharge that would happen with the arrhythmia. Your primary adverse reactions with the potassium channel blockers: nausea, vomiting, and again, as with the sodium channel blocking drugs, the potential to cause a worsening arrhythmia. In your class 4 drugs, your calcium channel blockers, so these will slow calcium activity within the sinus and atrioventricular nodes. So what you'll see with these is that you'll end up having a slow conduction velocity coming from the atrioventricular node, and this will help slow the heart rate down. Your adverse effects associated with these are going to be nausea, vomiting, and again the potential for a worsening arrhythmia. So this kind of looks at some general adverse effects you could feel. So as we were going through the different classes, I mentioned some particular ones that are very common with those particular types. In general, what you could find, lethargy, fatigue, bradycardia, so an extreme slowing down of the heart rate, hypotension, cold feeling in the extremities, increase in rhythm disturbances, which we had mentioned with a couple particular types, and then some other types, just some more general things, rashes, pruritus, which is also itching, headache, nausea, diarrhea, swelling, behavioral disturbances, and disorientation. Your drug interactions, if you look on table 6.3 on page 85, we'll just kind of note some particular drug interactions just that I want you to be aware of. This isn't something you have to answer in the discussion board. Just make sure you look at that table and look at what type of drug interactions that are associated with the antiarrhythmia drugs. So another treatment option that could possibly be opted for by the physician is through device therapy, where the arrhythmia is actually managed with an implanted device. So, and two different devices that are utilized, you have pacemakers and you also have implanted cardioverter defibrillators. Both of these are implanted inside the body, and don't necessarily think, you commonly hear about older individuals having these, but certainly younger people can also be fitted for these devices. I had, speaking from my own experience, I once had an athlete who did have a pacemaker. So it is important to kind of understand how to manage these. And what I have here, again, 2 more discussion post questions asking how do these devices work. Okay, so pacemakers and implanted defibrillators work in different ways. So note how those work, and then if an athlete is going to utilize one of these, what is going to happen? In other words, how can you manage this? So it's important to note these. One particular thing I'll tell you this right now is, in particular, some of your therapeutic modalities you have to be mindful of if an athlete is going to have a pacemaker or an implanted defibrillator. So the other major cardiac issue we're going to talk about is hypertension. So hypertension is basically diagnosed when an individual has a blood pressure over 140/90 on three different occasions. So there's 2 different types of hypertension. Another discussion post question, what is the difference between primary and secondary hypertension? And what are some complications associated with leaving an untreated and a prolonged hypertension? So those are some questions that I want answered on the discussion post as well, coupled with what is considered normal blood pressure, which is something that I'm sure you've talked about plenty of times at this point in your education, and what is considered pre-hypertension. So those are all questions that I want also addressed on the cardiac discussion board post. As far as recommendations for medications and restrictions, this isn't something you have to per se answer on the discussion board post. I just kind of want you to look at that. There's a table on 6.6 on page 88 in your textbook. Just some general recommendations for, particularly for an active population, and as far as what they should do, and what should the ATC question about in regards to blood pressure issues in athletes during the exam. Again, you don't have to answer that one in the discussion post as well. Just kind of a little thought question for your own purposes in kind of examining this topic. So you have to go through and look at, before we get into the different types of drugs as they relate to kind of regulating blood pressure, you have your autonomic stimulation of the heart, so that the beta-1 receptors, we talked about the different type of receptors that kind of reference this in the respiratory medications chapter as well. So your beta-1 receptors in your heart regulate the autonomic regulation of what goes on at the cardiac muscle. You have the two different divisions of the autonomic. You have your adrenergic, which is your sympathetic, and your cholinergic, which is your parasympathetic. So you see here the effects that are caused when these two different receptors get stimulated. So this kind of lets you know what the function of these receptors are, and as far as how they control, whether it involves speeding up heart rate or slowing down heart rate, increasing the contractility or decreasing the contractility. So before we even get into the different types of drugs, there's three different ways you can control blood pressure, and the different drugs that we're going to look at are going to help lower the blood pressure by one of these three basic mechanisms. You could control the blood volume, so obviously a higher blood volume is going to cause more pressure within the system. By lowering the blood volume, you could bring the blood pressure down. You could modify the blood pressure at the periphery, in the peripheral vascular system, and you can also modify it right at the heart by the myocardial action. So again, what I want you to be able to tell, particularly with these types of drugs, how they're going to monitor blood pressure, and again be able to just recognize the different types. So one type of drugs that can be utilized in lowering blood pressure are your different diuretics. So diuretics work by increasing urinary output. So here what we're looking to do is lower your blood volume. So by increasing urinary output, you're decreasing the amount of fluid in the blood, which is going to help allow and bring your blood pressure down. There are two different types of diuretics. You have your thiazide diuretics. They're less potent. However, they're also easier to use in individuals versus the loop diuretics. The issue with loop diuretics is that they can cause electrolyte disturbances, so these will not be first-line type of medications. The loop diuretics will not be first-line in dealing with athletes and very active individuals because of the fact of the potential electrolyte disturbances, and obviously severe electrolyte disturbances could actually end up causing a cardiac episode. So they will not be typically utilized in a younger, very active population. Angiotensin-converting enzyme inhibitors, or what are commonly known as ACE inhibitors. So these block the conversion of angiotensin 1 to angiotensin 2. So angiotensin 2 is a vasoconstrictor. So they will cause peripheral vasoconstriction and also help retain sodium. So by blocking that conversion of angiotensin 1 to angiotensin 2, you decrease your total peripheral resistance. So now what we're seeing here is the mechanism looking at the periphery of your circulation. By decreasing the vasoconstriction potential there, you're going to decrease your peripheral resistance. The interesting thing with these is that there are no effects related to ACE inhibitors that could impair athletic performance. So these would be a type of drug that in the situation with a very active individual that could be used. Now on the next slide, I'll just kind of review the whole concept of the ACE, the mechanism of the angiotensin system and how that works. So a little review of the renin-angiotensin system. So we look here at a kidney and go through how. Now again, what we're looking at here, again, the ACE inhibitors work by reducing that peripheral vascular resistance. So that's the most important mechanism we look at here. But again, when we look at the overall renin-angiotensin system, it's all regulated based upon how much fluid is in the body. So under normal circumstances, so we're not talking about somebody that has high blood pressure right now, you see the process by which if a person, say their fluid levels drop, so their blood volume decreases. So what would start to happen is their blood pressure would start to decrease because of having low blood volume levels. Well, when the kidneys sense that, it it will produce the angiotensin enzyme, which will be sparked by the production of something called renin, to allow the peripheral vasculature to cause vasoconstriction, to allow the blood pressure to increase. Because if your blood pressure were to drop from having reduced blood volume levels due to reduction in fluid, it would cause you to pass out. So in a healthy person, you want the blood pressure to be maintained in that circumstance, and that's how it does it through this route via the angiotensin system. Now, for somebody that has blood pressure issues, we want them to have an overall reduction in the peripheral vascular resistance. So where an ACE inhibitor works, if you look on the screen, the ACE inhibitor action is to block the conversion of angiotensin 1 to angiotensin 2. So what that will do is will reduce, ideally, the blood pressure in somebody who has chronically elevated blood pressure. Your alpha blockers, so your alpha blockers will block the alpha-1 receptors on the arterial smooth muscle. So we're looking at the peripheral vasculature here as well, working to be able to cause blood vessel dilation. There is no known effects on sports performance with these. One of the issues that they do cause some drowsiness, so by virtue of that, they won't be used very frequently, again, in your younger, more active population because of the issues with drowsiness. And then some other issues, the dry mouth and the impotence, could be associated with this as well. Earlier we discussed beta blockers. Beta blockers are also utilized to treat individuals who have high blood pressure as well. So we discussed earlier, they're a class of drug that gets utilized in the treatment of arrhythmias. They will also be utilized in individuals that have high blood pressure. The idea here is to decrease the heart rate and the contractility of the myocardium. So there are some issues here in relation to the energy systems and some athletes. I had mentioned previously, and it was something that I want you to look at for the purpose of the discussion board post. So for some athletes, this could be a problem. However, for other athletes, it could actually be a performance benefit. Again, it would depend upon the type of event you're looking at. So beta blockers are actually a banned substance. So again, for types of athletes, based upon their effects on the energy systems, it would basically force them to produce greater exertion over what they are already doing. However, depending upon the sport, it could produce a performance benefit. Calcium channel blockers will decrease the amount of calcium in the smooth muscle cells. Remember, smooth muscle cells will be present in your blood vessels, again, to regulate the amount of vasodilation and vasoconstriction. So in the situation here where you have decreased calcium concentration, this will produce, again, a vasodilation and will help to decrease vascular resistance. So here again, we see that peripheral vasculature mechanism here helping to bring down blood pressure. These types of drugs utilized for athletes can be very well. So physically active patients, this can be a first-line treatment for them because they tend to be tolerated very well. So again, what this will do is will decrease or lessen the vasoconstriction in the peripheral blood vessels, allowing for a reduction in blood pressure. And just to look at some of the adverse effects, so your diuretics, and we kind of already mentioned this already, the fluid electrolyte imbalances, the potential for orthostatic hypotension. So what that basically is hypotension that would occur in changing postures. So if an individual went from lying down to standing up, it causes their blood pressure to significantly drop. And you see that in people who are dehydrated anyway. So that would be, again, part of the fluid imbalance issues that an individual would have. Your ACE inhibitors, a dry cough, some of them shouldn't be combined with NSAIDs, so that would be something to be mindful of as well, especially given the fact that NSAIDs are a very commonly utilized drug, particularly in active individuals. The beta blockers, some of the issues with beta blockers involve their ability to exacerbate asthma. There's also the potential to increase perceived exertion. So one of the things I had mentioned was that for certain types of athletes, it can make it seem like they're having to work harder during their activity. So, and again, that has to do with the energy system issues that develop because of taking the beta blockers. Calcium channel blockers, there are very few major side effects, so it's something to note with them. So these have a tendency to become a frontline treatment, particularly, again, for individuals who are, again, very active, your younger athletic population. And then the alpha blockers, the drowsiness, extreme hypotension, and dry mouth are some of the issues associated with them. And again, looking at our primary patient population being athletes, so these are some other, two more discussion post questions that I want you to look at. So what are the first line choices for athletes? We had mentioned some particular ones that are utilized for that. And what are also lifestyle choices for cardiac issues? So, and again, that should be something, even just sitting here talking should be pretty common sense. So just when you look at cardiac issues in general, what are some lifestyle choices that can help, in addition to the medications, in any type of cardiac related issue? So again, there are quite a few questions that I wanted you to address in the discussion board post. So make sure, again, if you didn't write them all down or you weren't taking notes here, you should go back and make sure you do that. Again, the purpose for that is to make sure that you're paying attention to what's getting discussed and that you're picking out details from the online discussions. So you should be writing those down as we're going through them to know what you have to answer. And again, that will make the process make it a little bit more of an active learning process for you to be going through this. So these are some of just the learning outcomes, just to understand in general. So we talked about some of the different classes of drugs. Also just understand some of the basic physiology that we had discussed in relation to the regulation of the cardiac rhythm and also looking at the regulation of blood pressure.